Hey, good morning. We're going to go ahead and get started. I know you guys don't want to come in out of the sun. At least it's not a blistery February when we're doing this, like it seems to be. But we're so excited to be here today to announce the initiation of this project we've been talking about for quite some time to build a new rehabilitation hospital on the site that we're standing. And you know, this rehab is not something that's new to community, but it's going to be new in this format. We've been through Hooks Rehabilitation, have had a facility at East for many, many years, and have had all kinds of wonderful care delivered and outcomes. And Chuck Shearman's here today, and he's, as a former patient, he's going to talk about that. But we're here because of vision, because of partnership, and because of specialization. You're going to hear from Pat Foster from Centerre here in a second. And we chose them as a partner because, like many things that we need to do, we have patients, and we have patients that have needs, but we can't be the best at everything. And so we constantly are looking for outside expertise to say, hey, bring us new ideas, bring us innovation, what's working elsewhere. And that's what they bring to the project. And so we're going to learn together, we're going to do this in a partnership. The second thing is specialization and innovation. Also on this campus, we have a heart hospital, amazingly 10 years old. And we said many, many years ago in cooperation with a number of people that for us to do something the best, we're going to have partners and we're going to have specialization. And so we've specialized in that. And this is a special hospital designed for patients, families, therapy, nurses, to make sure that we have the best outcomes possible. And we said to do that, it needs to be its own place. And we talked about doing it at East, and a lot of people have been critical that we haven't done it at East. We're not doing it at East for a couple reasons. One, we don't have room, we don't have space, we don't have land. But the other thing is accessibility. And we think by where this sits and the interstate access and where our patients come from, this gives us a better way to deliver this care. And then finally, because of everything that's all the innovation with brain injury and neurosciences, we know that there's all kinds of things that are happening that we need a lab to do that in. And so we can design this lab on our own. So we're so excited to be here today, going through this process, and in about a year from today, we'll be seeing patients up here. So very, very big deal. So the Community Rehabilitation Hospital is well on its way, and I can assure you, you're going to continue to hear more about things we're doing, not only with affiliates that are joining us, like most recently Howard Regional and Kokomo, but also with other partnerships, other outreach, and other specialization. So with that, I'm going to introduce my friend, Dr. Robin Ledyard.
Thanks, Brian. Thanks, everyone, for being here today. As the president of Hospital East, it's a pleasure to move in this direction. As a family physician, I've known about Hook Rehab for quite a while and the great outcomes that they have. Becoming president 3 years ago and getting to work with Doug Beebe and learn about the operations of Hook more and the ability, as Brian said, to move out into the community, to have a freestanding facility, it just makes so much sense for us to take it out of the hospital, to work with Centerre on their expertise, and to provide this rehab facility to the citizens of Central Indiana and beyond. Also, as the president of Community East Hospital, I'm very proud to say that Community East will continue to serve the citizens of the east side of Indianapolis. Our emergency room this year will service approximately 70,000 visits. That's the doors open to the people who need the service at the point of care. Also within the hospital, we will continue to provide high technology, state-of-the-art acute care services. I'm very proud to be leading a facility that was built with dollars from the community for the community. And at Community East, to be part of a network that has grown from that heritage to continue to outreach and expand, as Brian said, within Central Indiana only brings me great pride. So thank you for being here today. And it's my pleasure to introduce Pat Foster, the head of Centerre, who's going to talk to you about his services.
Good afternoon. Well, I guess it's still morning, isn't it? Good morning, good afternoon, whatever. Thank you, Bryan, and thank you for everyone for taking the time to join us today. I particularly want to thank the families who are here, who have utilized the services of the Community Health Network. And beyond that, I would really like to welcome and thank the clinician team, the clinical team that has worked with the patients within the network. This is a wonderful opportunity, and we at Centerre are very, very excited about it. I was talking to one of our architects coming up, and he said this project has gone better than any we've ever done. So that's a tribute to your team, and of course to mine too, but your team and the clinical team. So, I'd like to take just a minute and recognize if the individuals from Duke Realty, who are the developers on this project. If we just give them a brief round of applause, please. And Earl Swenson and Associates are the architects on the project. Just if you could recognize them for just a minute. And I think everyone is familiar with Pepper, the general contractor on the project. Thank you for working on this project. And I would particularly like to thank Matt Herb, who's with Centerre, and Doug Beebe. Doug, stand up. I don't want to embarrass you, and the clinical team that Doug brought through, this is just not bricks and mortar. I'm telling you, we had a great input from your team, and it's a very functional. We've done 8 or 9 of these hospitals, and we learn something new every time, and you guys were great, and you're going to be great to work with. The vision that we have for the hospital that will be delivered, it's an opportunity, again, for this network and for us to put the patient first. And that's what this new hospital is all about. If you look at the renderings and you look at the facility where the patients are treated today, I met with the clinical staff locally, and what a great team. But, you know, you're crowded. This new facility will go from 37,000 square feet to 63,000 square feet. Right now, when at dining time, and educate the patients on the reentry to the community. I think, Doug, you can seat maybe 12 patients. We'll be able to seat 60. And one of the unique features about this facility is the outside therapy courtyard. We return people to productive lives, to home, to live lives like they lived before. And this courtyard is going to be very neat. It's going to have any surface that a patient, and unless you've had a stroke or you've dealt with a patient that have had a stroke, this sounds real simple, but it's not. But it's going to have the different surfaces that a patient has to deal with, even in walking. It'll have gravel, it'll have wood surfaces, it'll have a surface similar to this. It'll have curbs. It's the things that we all take for granted that the individuals that work with these patients don't, and so that's going to be a great new expansion. So, in closing, Bryan, I would like to make a commitment to you and to Community Health Network. First of all, thank you so much for the opportunity to do this joint venture. But you have the commitment from me, my team, and my board to provide superior patient outcomes, superior patient satisfaction, superior staff satisfaction. And we will always, and I emphasize that, always put the patient first. So thank you so much for this opportunity.
Well, Pat, I'm just so glad that there's TV cameras and reporters and everybody here to make sure that they have that chronicled for us. Because that is what we're all about, and that's the only reason we're here. I want to move on to what I believe is the most important part of this groundbreaking. You know, I'm proud of the things that we do in this community, within community. I'm so proud of the care we deliver, and I'm so proud when I hear the wonderful stories of patients that have gone through Hook and other parts of our hospital. But every so often, one's personal. Yesterday, I received a list of who was going to be the speakers today, and Chuck Shearman's name's on here. I can tell you, I lost a breath, I shed a tear, and I looked forward to seeing him today. Chuck's a friend of mine. He's coached each of my 4 sons in football. He's somebody who's a stalwart within our community because of what he does to give back to others. I did not know he had a brain tumor until his wife called me probably 4 years ago, I would guess, and said, Bryan, I don't know if you're the right call or not, but we need help. And at that point in time, I did what I do all the time, is I make sure people know I don't know anything about medicine at all. But I know a boatload of people who do. And so I called Doug Beebe and I said, Doug, I need help. And the immediate attention, the action, I got it, I'll take that baton, I'll take care of this, was something I'm so proud of this network about, because that's how we approach everything, because everything is personal to somebody. And so when I saw this morning, and when I see Chuck in the community and what he's doing to give back, I'm so proud of him and so grateful to be his friend, but I'm very, very proud of us. So Chuck, thank you so much for doing this today. Chuck Chairman.
Little difficulty with the stairs. When I started out, I had seizures during the summer of 2007. And like most people do, I self-diagnosed it, you know. And finally, the seizures became so bad that I had to go to my family physician. And he said, let's eliminate the obvious. And so he sent me to have a CAT scan. And the CAT scan came back, and I don't know how many of you have had procedures that are generated by your family physician. I mean, like, you know, typically it takes a few days to get a call back. I got a call back that night. And there was a mass in my brain, and it was a meningioma, which is a fancy word for a brain tumor, and it was large. So I was told to get my affairs in order, and to make my peace with everybody. And so I did that. And a couple days later, my surgeon said, oh yeah, I can take that out, and no big deal. It was benign. So I was fortunate in that respect. The problem I had was that it was really large. It was, you know, basically the size of a fist. And when they got in there, it was the size of 2 fists. It was a 4-pound brain tumor. So they removed it, and where it attached, I had a stroke, a traumatic brain injury, if you will. And I was visited by Bryan in the hospital, and that's, I'm told, where the idea for this came from. And I was always the type to just figure it was fate, so that I would have surgery, and I would either recover or die. You know, I didn't realize how big the area was in between there, and what the need was for rehab. I went through all types of rehab, subacute, acute, home, back to work. And so I'm an aficionado on every kind of rehab. I mean, I did this over a year. I've done it since as an outpatient, and I do it still as as an individual because you have to. I see Rehab out in the audience. I had an interesting incident with her, but just to explain generally, she was trying to move me. I fell, and she sacrificed her body to keep me from going to the floor. And that's the level of care you get at these places. Actually, my son, who's a stand-up comedian, helped with my physical therapy when my physical therapist was going on vacation. And this is when I was doing home health care. And he used to stretch me, and his explanation of pain, and he was a wrestler too, and his explanation of pain, he said to me, "Tell me how much it hurts in Roman numerals, in barnyard animals, small to big, on the Richter scale." I mean, that was my favorite. Since then, I've endeavored to, I've returned to work. I've run my own company, and it's a financial planning firm called Prospero, and I try to give back to the people in the medical community that have a need for financial planning, and I like to give back to the physical therapist, the occupational therapist, the speech therapist, and the nurses and the doctors that worked with me, that helped me out when I was in need. There's a great need for physical therapy, for therapy in general. This rehab center is state of the art, and I appreciate and I'm proud to be a part of it. Thanks.
Hey, Chuck, thank you so much for sharing your story. And just helps to visualize what we're doing and why we're doing it. And the fact that you have returned to your business, left it, and have restarted that is a testament to what we're able to do when we get everybody kind of working towards a common goal and to figure out what's the best outcome that we can achieve for each patient. And I'm glad that we've been able to do that for you. We're ready to break some dirt. So I'm not sure, Linda, where we're going to do that. It looks kind of hard out there, but a box of dirt. Okay, we're going to break a box of dirt. So thank you all again for coming today. For those of you that might have some questions, we'll be glad to address any questions, but we're going to go back out to the right corner here and break some dirt, and we'll be seeing patients in a year. Thank you.